or having a parent or sibling who had it. Having specific inherited gene mutations called BRCA1 and BRCA2. Having Ashkenazi Jewish ancestry. Drinking more than a small amount of alcohol, and being overweight or obese, especially after menopause. Screening for breast cancer can help find cancer early and save lives. Screening includes examining your own breasts, having a healthcare provider examine them, and having an X-ray of the breasts called a screening mammogram. You can check your own breasts about the same time each month. Feel each breast and armpit and look for any of the signs of breast cancer previously discussed. A diagnostic mammogram is used when a change is seen on a screening mammogram. It includes extra detailed images of the breast. A breast ultrasound is often used to determine if a suspicious lump is solid or fluid-filled. A fluid-filled lump is often benign or a cyst, while a solid lump can be cancerous or a benign fibrous growth. A breast MRI shows more detail than a mammogram and is often used for very small masses or changes in the breast that cannot be seen by mammogram. A breast biopsy is a test that removes a few cells or a small amount of tissue from the suspicious area in the breast. There are various types of biopsies. A doctor called a pathologist will analyze the breast biopsy tissue by looking at the cells under a microscope and doing specific tests. Their report will let you know if you have cancer and if it grew because of estrogen, progesterone, or HER2/neu protein on the cancer cell. The results of these tests help your doctor choose the right treatment. Doctors classify breast cancers based on how they behave. This includes non-invasive, cancer that has not spread outside the tissue where it began. Invasive, cancer that has spread and invaded healthy tissue. Recurrent, cancer that returns after it was treated. And metastatic, cancer that has spread from the area where it started to other areas of the body. Common types of breast cancer are invasive ductal carcinoma and invasive lobular cancer. Less common types of breast cancer include inflammatory breast cancer, tubular breast cancer, colloid breast cancer, and metaplastic breast cancer. Triple-negative breast cancer means the tumor has no estrogen, progesterone, or HER2/neu protein receptors on its surface. Triple-negative disease may have a worse outcome and often requires more intensive treatment. Breast cancer staging is determined by the size and location of the cancer and whether it has spread to other areas in your body. Breast cancers are graded 1 through 3, with 1 being the most similar to normal, healthy cells, and 3 being the most different from normal cells and the most aggressive. Breast cancer treatment depends on the type and stage of your cancer. You will need treatment from a cancer team specializing in different areas of medicine. The main treatments include surgery, radiation, chemotherapy, hormone therapy, targeted therapy, and combination treatments. Common types of surgery for breast cancer are lumpectomy, removing the tumor and a small portion of healthy normal tissue around it. Simple mastectomy, removing the entire breast. Modified radical mastectomy, removing the entire breast and lymph nodes under the arm. Prophylactic mastectomy, removing one or both breasts to reduce the risk of developing breast cancer. Mastectomy with reconstruction, reconstruction at the same time as removal of the breast. Sentinel lymph node biopsy, a procedure to determine if one or more lymph nodes contain cancer cells. And axillary node dissection, surgery to remove lymph nodes in the armpit region. Reconstructive surgery is a procedure done to restore the appearance of the breast after a mastectomy or large tumor removal. Radiation therapy uses radiation energy to kill cancer cells. It is mostly recommended after surgery or chemotherapy. Chemotherapy is the use of drugs to destroy cancer cells. It is given as an IV or a pill. Chemotherapy can be used to shrink a tumor before surgery, called neoadjuvant chemotherapy. Kill cancer cells after surgery, called adjuvant therapy, and control metastatic breast cancer, called palliative chemotherapy. Hormone therapy is given if your tumor is positive for the hormones estrogen or progesterone. Hormone therapy is used to lower the risk of breast cancer coming back and help shrink or slow the growth of metastatic estrogen receptor positive breast cancers. Tamoxifen and aromatase inhibitors are common hormone therapies for breast cancer. Targeted therapy uses drugs or other substances to identify and fight specific types of cancer cells with less harm to normal cells. Targeted therapies stop cancer cells from growing, identify and kill cancer cells, and increase the immune system's attack on cancer cells. HER2 is a common protein that is blocked with targeted therapy, for example, trastuzumab. Targeted therapy is often given along with chemotherapy. Metastatic breast cancer is cancer that is spread from the breast to other areas of the body. The most common places are the liver, bones, lungs, and brain. There is no cure for metastatic breast cancer, and treatment is to prolong survival. Today, people are living 5, 10, or more years with metastatic breast cancer due to advances in treatment. Metastatic breast cancer treatment may include ongoing chemotherapy, hormone therapy, targeted therapy, and new innovative medicines in clinical trials, such as immunotherapy. Survivorship is a term used to describe anyone who has had breast cancer and is still living. As a survivor, you will have different care needs than when you were in treatment. Your cancer team and primary care doctor can help you meet these needs in the years after treatment. It is frightening to learn you have breast cancer. However, the information available can help you receive timely, individualized, effective treatment that can give you the best chance of being cured. Ask
Hashmi
your
Medical
doctor or
Center
cancer
Darbar
team
Sultan
if you have
Bahu Road
any
at
questions
Dakilpur.
about your
Dr.
treatment plan.
Shahzad Anwar Hashmi and qualified doctors under the supervision of State Life Corporation will conduct free examination from 1 October to 8 October, in which the patients will be informed about the precautions and treatment of breast cancer.